Your clinical work is excellent. Your team cares deeply about the patients in front of them. But somewhere between the therapy session ending and the insurance check arriving, the process breaks down. Claims get kicked back, staff burn out trying to keep up, revenue sits uncollected for months at a time, and nobody in the practice has a clear, actionable answer for why it keeps happening. If this sounds familiar, you need to know you are not failing at practice management. You are caught in an industry-wide crisis. Thousands of behavioral health practices are actively leaking the revenue they have already earned, despite providing life-saving care. This bar chart shows exactly what you are up against. On the right, general medical and surgical claims face a 5 to 10% denial rate. On the left, behavioral health claims see denial rates of 12 to 20%. That means you are facing nearly double the denial exposure simply because of the specialty you chose. Those denials happen because behavioral health carries highly specific rules. Psychotherapy codes, intensive outpatient programs, and psychiatric evaluations require exact modifiers and intensive documentation. A single missing modifier triggers an automatic rejection. Then there is the prior authorization volume. Physicians and their staff now spend an average of 13 hours every single week completing insurance paperwork. That is 1.5 full business days consumed entirely by administrative hurdles. Behavioral health already demands elevated emotional labor from practitioners. Layering this extreme administrative load on top is the reason 89% of physicians cite prior authorizations as a direct cause of burnout. Standard medical billing workflows fail here because the administrative system is structurally designed to penalize the complexity of behavioral health care. The intuitive solution is to hire more in-house billing staff. You have a volume problem, so you add headcount. But look at this breakdown of true employment costs. The median salary for a billing specialist is around $50,000 a year. Once you add employer payroll taxes, health benefits, paid time off, software subscriptions, and physical overhead, that single employee actually costs your practice between $90,000 and $140,000 annually. And that assumes they stay. Billing roles see extremely high turnover. When a specialist leaves, their replacement requires weeks of training. During that window, follow-ups fall behind, and your accounts receivable days steadily creep up. Because of these staffing bottlenecks, a staggering 60 payers now use automated systems, specifically calibrated to flag claims where clinical notes may not perfectly support the billed level of care. Telehealth multiplies the difficulty. Each virtual session demands the correct place of service code, specific originating site notations, and payer-level authorizations that vary across state lines. Using generic F codes invites audits, and handling substance use disorder records introduces the strict regulatory rules of 42 CFR Part 2, where a simple paperwork error carries severe legal exposure. A generalist approach to these codes leaves a practice wide open to permanent revenue loss and compliance audits. Financially healthy practices have recognized this reality and are stepping back from the in-house model entirely, shifting to a more resilient infrastructure. They partner with Staffingly. Staffingly provides dedicated, credentialed billing specialists who are explicitly trained in the nuances of behavioral health coding. These specialists work directly inside your existing EMR, whether that is Epic, Athena, or eClinicalWorks. They operate exactly like an internal team member, managing daily workflows without the physical overhead. Independent practices suddenly gain access to a highly trained, enterprise-level billing department without carrying the massive fixed costs. This human expertise is supported by an AI-augmented workflow layer that handles predictive routing, ensuring complex tasks go to the right specialist immediately. Before any claim leaves your system, an automated audit proactively catches missing modifiers, coding errors, and payer-specific rule violations. The AI does not replace the specialists. It acts as a force multiplier. By stripping away the manual detection work, it allows the human team to maintain an error rate below 1% across the board. Many practices suffer from the verification gap. They check eligibility at intake, but behavioral health treatments run for months. When coverage changes mid-treatment, the practice only discovers the lapse after dozens of sessions have already been billed and denied. Staffingly eliminates this entirely. They perform continuous eligibility checks before every single session and manage a dedicated tracking pipeline for all prior authorizations. Continuous verification stops revenue leakage at the source. Billing shifts from a desperate post-session scramble into a quiet pre-session guarantee. Compare the economics. A single in-house biller costs at least $55,000 in base salary alone. Staffingly delivers specialized output inside your EMR for a predictable $399 per week per seat. You eliminate turnover risk. You eliminate training lag. You get built-in SOC 2 compliance, and the entire system goes live in just 14 days. Over 800 healthcare practices across the country have already made this transition, turning volatile cash flow into predictable collected revenue. Stop treating billing as a back-office headache. Start treating it as a revenue protection strategy.